Dr. Obeime, this is a question for you from the audience. We talked earlier about how the healthcare reform proposals do not cover any illegal immigrants or not explicitly cover any illegal immigrants. What's your opinion on actually providing them services and covering them, and could doing so actually save money in the long run?
Gee, I'm going to be in trouble anyway I answer this question, so I have to see which way may be a little easier for me. When we talk about illegal immigrants, sometimes I think that people do not hear the illegal, they just hear immigrants. And that's why there's a lot of anger, and sometimes there's a lot of frustration. Because we have to look at the real issues, okay? Let's say I use Wishat because anybody can go there. If we have a patient, I don't care where the patient came from or what their status is. If this patient shows up at Wishat and has active TB, or now that we're talking about the H1N1 flu, and has this condition, can we, in our right minds, say that we will not treat this patient? And if we did not, how would we get rid of this patient, regardless of where the patient came from? I don't know which airline you could tell that this patient has one of these two conditions. We don't want to treat this patient in this country. Put this patient in your plane and fly them somewhere. I don't see how that could fly, okay? But having said that, though, I think that if we had it written in bold that America takes care of illegal immigrants, we're setting ourselves up for trouble. In Canada and in Europe, if you do not have your card, you're going to pay for care. But as Mr. Evans said, people know how much it costs. People are leaving the US to go to India, to go to Europe to get their hip replacement done for about $20,000 or $10,000, depending on where you go. And these are self-insured people who know this is how much it's going to cost me, and I know I can pay that. In this country, you cannot do that. If once somebody is uninsured, even if they said, I have X amount of money to pay for this, then there's a crisis. One way I know it's been done where people would choose to pay cash for their services has been OBGYN. Before it became so easy to get Medicaid for delivery, I know for a fact that my husband is in the room, so I hope I don't get in trouble for using this example. When I had my first child, we did not have insurance that covered pregnancy because my husband was single. He didn't think he needed insurance. And when I came here, before we got insurance, I got pregnant. So we're self-paid. But what we did, I had her at Humana Women's Hospital. They told us ahead of time, if you pay X amount of money, this is how much you would have to pay. But you needed to pay it now before you even delivered the baby. So we went ahead and paid that amount, and I got decent care. I got perfect, wonderful care. My daughter is doing wonderful. So that is what we have to look at. So when we are talking about illegal immigrants or no illegal immigrants, I think the fact that it is inflammatory politically is what people are afraid of and why people are afraid to take a position. I think we should not announce that we're going to do that, otherwise we might have an influx. But at the same time, I don't see how we can not treat people if our lives are in danger because one person has it. So I don't know if that helped, but.
Can I make a comment on that?
Yes, Dr. Brater.
Just very briefly, I think it goes back to what Dan was talking about. I mean, we're paying for this care anyway.
Yeah.
To think we're not paying for that care is naive. So a patient shows up in an emergency room, wherever, hopefully they're going to be taken care of. I mean, I certainly don't want to be a part of a society that would turn a sick person away from an emergency room, for God's sake. So we're paying for this anyway, but then the way we're doing it is that the care is occurring at in the most expensive venues in the emergency room. So in many ways, to me, it makes more sense to have a system that will make sure that there is a way to provide health care to people who need it and do it in the most cost-effective way. And again, that's not in the emergency room. So I think it needs to be addressed. I realize it's highly politically charged, but another way for me to look at it is that I think it would be morally reprehensible for us to even comprehend a system where we turn people away at the door who need health care.